Nothing gives me greater pleasure than to open this plenary session where the Forum for Collaborative HIV Research will present the third C. Everett Koop HIV/AIDS Public Health Leadership Award to Congressman Henry Waxman, and welcome. At the 2010 summit, the Forum introduced the Koop Award to honor an individual whose contributions to research, education, and advocacy have significantly improved the lives of Americans with HIV. We were thrilled to give the first award to Dr. Koop, who accepted the award from his friend and longtime colleague, Dr. Tony Fauci. Last year, the Forum honored Tony Fauci with the second Koop Award, and Tony's friend, Congressman Henry Waxman, presented the award. Continuing with this wonderful tradition, I think we'll have to invent cloning next. Continuing with this wonderful tradition, the Forum is thrilled to bestow the third C. Everett Koop HIV/AIDS Leadership Award to Congressman Waxman. No one in the Congress has been a more ardent champion for people with HIV and for public health than our honoree. Congressman Waxman represents California's 30th Congressional District, which includes the cities of Santa Monica, Beverly Hills, West Hollywood, and the neighboring areas of Los Angeles. Some of these areas were at the epicenter of the AIDS crisis when the epidemic first began in 1981. But going back to 1974, when he was first elected to office, Congressman Waxman has represented all of us in the HIV/AIDS community, as well as those fighting viral hepatitis. Previously, as the chairman of the House Energy and Commerce Committee, and now as the ranking member, he continues to fight for universal health insurance, comprehensive Medicare and Medicaid coverage, and women's health and reproductive rights, among other health priorities. Regarding HIV specifically, Congressman Waxman's advocacy goes back to 1982, when he convened the first of over 30 hearings to raise public awareness and secure initial government funding for AIDS research. Since then, he has written and helped enact federal legislation to fund the search for a cure and to bring meaningful relief to people living with HIV. One of his important accomplishments was enacting the Ryan White Care Comprehensive AIDS Resources Emergency Act in 1990, and then making sure the act was reauthorized and properly resourced. When measuring Congressman Waxman's impact over these 30 years, the language of the C. Everett Koop Award says it all. Representative Waxman is being honored for advancing the nation's progress and fighting HIV/AIDS through distinguished service, vision, and leadership. Clearly in the US Congress, no one embodies these characteristics more than he. Now, we would like to air a short video tribute that provides further context for why we're honoring Henry Waxman today. And then our friend and colleague, Tony Fauci, will give some personal remarks reflecting on Congressman Waxman's many contributions to the HIV/AIDS community. And because Dr. Koop, who was here in 2010 and again in 2011, is unable to attend today's award ceremony, he's 96 years old this year, he asked one of his principal lieutenants, Dr. Woody Kessel, who was acting Surgeon General at HHS and worked closely with Dr. Koop and Dr. Fauci, to represent him on the dais. So welcome, Woody Kessel. After Tony speaks and presents the 2012 Koop Award to Congressman Waxman, we look forward to hearing from our honoree, both regarding his insights from the past and his priorities for addressing the twin HIV and viral hepatitis epidemics in the future. And now let's see the video.
Chairman Henry Waxman, who began holding hearings on AIDS in 1982, before there was even a name for AIDS, was leading here in Washington to make sure that this got the informed attention that it deserved, and who led the House in passing the original Ryan White legislation.
Henry Waxman has been a leader. He's been a conscience of the nation around public health issues in general, but HIV in particular. And it's hard to imagine how we would have dealt with this epidemic without having Henry Waxman as chair of the Health Subcommittee in the early years and then chair of the Energy and Commerce Committee. He had on his committee some people who held very bizarre beliefs about how HIV was transmitted. And he used those committee hearings as a way to debunk a lot of the myths around HIV, as well as to push policy forward. That's a very difficult balancing act.
Well, in the early days of the epidemic, when really no one really knew what was causing this disease, the first thing we really needed to do was to be able to figure out where it was and how it was spreading and many important things before there was even a test for HIV antibodies. Representative Waxman was very influential in helping the CDC get funding. I remember around $5 million to help do surveillance, to really see where the epidemic was starting, how it was spreading, better help us understand how blood transfusions, mother-to-child transmission were all involved, and that really mapped out what we're going to be dealing with in years to come.
There was no way we would get to know what this epidemic was all about, how to treat it, how to eventually even think about curing it without adequate funds being available. And he really took on the charge to make sure that Congress approved dedicated funding for research in HIV/AIDS. He's also been a tireless advocate for ensuring that the integrity of research and its translation into policy is maintained.
During the entirety of the 80s, we went through roller coasters in which the public and the press were either apathetic, couldn't care less about AIDS, or were panicked and wanted to quarantine everyone. So trying to find that middle ground of urgency, there was neither panic nor apathy, was, I think, his strongest commitment throughout the early 80s.
We cannot shortchange the epidemic. It is threatening the lives of hundreds of thousands of Americans. It's threatening the solvency of our public health system.
What's particularly compelling about HIV is that it tends to occur to highly stigmatized populations. So his support of the gay and lesbian civil rights legislation, even though it hasn't become law, that became linked with the fight against AIDS. His support for the Americans with Disabilities Act, which was a critical component for assuring that all people with HIV and AIDS would be protected from discrimination. Again, he played a role in that effort as well.
In the mid-80s, Henry did a number of news interviews. One of them was a television news interview from a California television station. And she surprised me at the end of it by asking him a question that she had never mentioned to me, which is, isn't it true, Mr. Waxman, that you're working on AIDS issues because you represent West Hollywood, which is a gay ghetto? And Henry paused and he said, no, first of all, I work on this because I'm the chair of the committee that deals with public health, and this is an emerging public health issue. Secondly, would it be so bad if I did work on AIDS for that reason? You don't really question when a Pennsylvania congressman works on steel issues because he has steel workers in his district. And third, I work on AIDS because, in a larger sense, because I'm a Jew and I know what it's like for a society not to care if you live or die.
While we had to create a separate program like Ryan White to address the needs of people with HIV, simultaneously he was pushing to make sure that the existing system, like the Medicaid system, really was responsive to the needs of people with HIV. And so, health reform is actually the culmination of that effort.
I've worked off and on with him for 30 years now, and I can't think of anybody who measures up to him as a shrewd politician, but also as a really pragmatic and creative thinker about how to put laws together. I just admire him very much.
We obviously need continued leadership from people like Henry Waxman, and Henry Waxman in particular, because he carries the history of this issue and knows it probably as well as any of his staff, and you can't say that for many members of Congress.
There's no one in Congress that comes even close to what he has done. He definitely played the star role. We are so honored to present the third C. Everett Koop HIV/AIDS Public Health Leadership Award to Congressman Henry Waxman.
So if we could put the first slide up. There you go. Thank you. So, first of all, thank you very much, Veronica and others, for giving me this opportunity, which I treasure, to have the real great pleasure to honor and introduce truly a most extraordinary man, someone I consider a friend, a co-conspirator, a mentor in some respects, and truly one of the giants of our Congress, Representative Henry Waxman. And as you all know, we're here today to recognize his decades of accomplishments and leadership in shaping the U.S. government policy on HIV/AIDS, which really translated in many respects into global policy. And I'm really, honestly, quite thrilled to be part of this celebration. As many of you know, Representative Waxman began his career in Congress in 1975, more than 35 years ago, and as Veronica said, representing the 30th Congressional District in Southern California. Now, although Henry is an unabashed liberal, in his career as a public servant, he has become legendary for always being on the right, that is, the correct side of the issues. For example, uncovering fraud and abuse in government, protecting the environment, defining the rights of women, and making health care affordable. And in addition to HIV/AIDS, he's been a strong and consistent congressional leader and an advocate on several other important health issues as well, including regulating tobacco, food safety, and nursing care reform. So I just wanted to put into context, although we're honoring him here today mostly for what he's done in HIV, this is a man whose influence has gone well beyond HIV, and I think it's important to point that out. It is simply impossible to convey the breadth of his enormous contributions to the well-being of the American public and to our nation and to the world in just a few minutes. However, I can give you my own personal perspective from the standpoint of someone who's had actually the privilege of being with Henry on the front lines and at the same time observing his extraordinary accomplishments since the earliest days of the HIV/AIDS pandemic. I have had the opportunity over nearly 30 years to interact with Henry on many, many occasions, primarily after I became the director of the National Institute of Allergy and Infectious Diseases in 1984, and so I can say that I do speak from decades of personal experience. Now, according to our records, I have testified at approximately 25 hearings in which Henry participated in some capacity as chair, ranking member, or member of the committee or subcommittee. And so I got to know Henry very well. Several of these hearings focused on HIV/AIDS, but these hearings spanned a range of topics touching on other important health and research issues, including drug abuse, tuberculosis, influenza, BioShield, remember BioShield, Henry? NIH oversight, antibiotic resistance, synthetic biology. One of my first official appearances before Henry at a congressional hearing was in February of 1988. I was testifying at a hearing before the House Energy and Commerce Subcommittee on Health and the Environment that he chaired. It was entitled Public Health Service Update on the AIDS Epidemic. And of note, Dr. Chick Koop also testified right next to me at that hearing in his capacity at the time as Surgeon General. On several other occasions between 1988 and 1994, I testified before Henry's subcommittee on HIV/AIDS. In 1995, the majority party in the House changed, and so Henry became a member of the minority party until 2006. He was not a happy camper during that period of time. However, back in the saddle again in 2008, he chaired a House Committee on Oversight and Government Reform, and I again testified before him. At these and other hearings, I would watch him in wonderment and admiration, and that's the truth. He was a man of extraordinary integrity and commitment, and in his position as subcommittee chair, although always respectful of the proceedings of the Congress, he was a true warrior and is to this day. He gives as good or better than he gets, and he doesn't take flack from anyone. There would be times when he and some Republican congressmen would be debating an issue, going at each other, and I would just be sitting there watching. You saw on the film, Jeff had mentioned that there were some people with crazy ideas back then about HIV. As I watched this back and forth between Henry and his colleagues' opponents, I always kept in mind the old saying, when you are sitting in a rowboat and two people stand up and start swinging oars at each other, the best thing to do is to just stay seated. I often sat there and enjoyed the tennis match going back and forth between Henry and others on the committee. It was entertaining, but quite educational. Certainly, Henry is the kind of warrior you want on your side. When he was not in his position as chair, he was constantly pushing the envelope for causes he held dear, particularly HIV/AIDS. The HIV community has had no more stalwart elected champion than Henry Waxman. As a member of the executive branch of government, I often found myself testifying as the government witness. During the early years, when he was not happy with the response to the HIV pandemic on the part of the administration at the time, he would chide me in front of the committee and tell me to deliver a firm message back to the administration. However, he always did this with respect and always made it clear that he supported what I was doing, but he had problems with the administration, and he always kept the two of us separate. After certain hearings, when he was particularly peeved, the good guy in Henry prompted him, after the C-SPAN camera shut off, to come down from the dais to me, where I was bleeding at the witness table, shake my hand, and with a twinkle in his eye say, "Tony, you're doing a great job. I hope that you know it was nothing personal." Indeed, we developed a real friendship and mutual respect that I hold dear to this day. Henry is responsible for many firsts. You heard that on April 13th, 1982, Henry, who was then the chair of the House Energy and Commerce Subcommittee on Health and the Environment, held the first congressional hearing on AIDS. This was the start of his record of 30 hearings that he had held during his 16-year tenure as chair of the subcommittee. The hearing took place in Hollywood at the Los Angeles Gay and Lesbian Community Service Center. It was a little less than a year since the first cases of the mysterious disease were reported in June of 1981. According to an account in the Washington Blade, D.C.'s gay newspaper of record at the time, Henry did not mince words. Quote, "I want to be especially blunt about the political aspects of Kaposi sarcoma," he said. "This horrible disease afflicts members of one of the nation's most stigmatized and discriminated against minorities." He continued, "There's no doubt in my mind that if the same disease had appeared among Americans of Norwegian descent or among tennis players rather than among gay males, the responses of the government and the medical community would have been different." He noted that the outbreak of Legionnaire's disease a few years earlier appeared to have received greater attention and even funding for research and treatment than did the latest outbreak of Kaposi sarcoma and pneumocystis pneumonia among gay men. It became very clear after that hearing that for the growing numbers of a minority group disproportionately affected by this mysterious new disease, Henry was the brave and desperately needed advocate, one of the elected officials who rang the bell first, insistently, and clearly. His unfettered honesty and compassion was immeasurably important for a community just beginning to realize an enormous, stunning, and horrific measure of suffering and death in the prime of their young lives. On September the 24th, 1982, Henry and Philip Burton introduced legislation to allocate funds to the CDC for surveillance and to we at NIH for AIDS research. In May of the following year, the Congress passed the first bill that included funding specifically targeted for AIDS research and treatment, $12 million for these HHS agencies. Can you imagine then? $12 million, and the budget of the NIH today for AIDS is over $3 billion. a lot due to the pushing that Henry did during those years and even to today. In 1993, he authored legislation signed by President Clinton that established the Office of AIDS Research within the NIH to plan and coordinate our AIDS research efforts. His approach to responding to AIDS has always been on point and comprehensive. In addition to ensuring adequate funding, he supported a host of other initiatives and legislation that were absolutely needed to ensure a vigorous public health response as researchers like myself and many others worked on understanding the disease and developing new and better ways to diagnose, treat, and prevent it. To address the stigma associated with the transmission of disease among homosexual, bisexual, and drug-using populations, and practices that put individuals most at risk, he insisted that information about the disease that was developed and disseminated by the government be candid and straightforward, and importantly, that the confidentiality of people with HIV be protected. In a statement he issued in May '95, he wrote, "In a perfect public health world, it would be better if people just stopped having sex and using drugs until there was a vaccine for AIDS. But this isn't a perfect world, and the federal government needs to acknowledge that many people will have sex or use drugs today, and that preaching abstinence isn't the answer for anyone. It's imperative that we tailor our preventive programs to the affected communities so that they reach Americans where they live and how they live." Now, just remember, he said that in 1995, and now that's the theme of what everyone is talking about now. So talking about being prescient, here he is. He also realized that those infected with HIV deserved the best care to keep them and staying healthy from the time they became infected and before they showed overt symptoms of disease. He took the lead in promoting Medicaid expansion for early intervention for people living with HIV, targeting programs to prevent TB, pneumonia, and other opportunistic infections. And he was also an advocate for the parallel tracked approach, which was introduced in 1989, which helped to make experimental drugs widely available to severely ill patients and to speed the review and approval of licensure of these products. And importantly, you've already heard from the film and from other introductions, to complete his comprehensive approach, he authored the landmark Ryan White Care Act in 1990. This law was named, as you know, after the brave Indiana teenager who contracted HIV through a tainted hemophilia transfusion. He was expelled from, Ryan was expelled from school, became a well-known advocate for AIDS research and awareness, and died at a young age of AIDS. This law established a large-scale program of healthcare services for people living with AIDS, as well as an effort to prevent infection among the uninfected. It especially sought to improve the availability of care for individuals with low incomes or inadequate health insurance. The act was reauthorized in 1996, in 2000, 2006, and again recently in 2009 by President Obama. Well, Henry is still at it today. Here is a photo of Henry with Nancy Pelosi, Elton John, and I at the International AIDS Conference held here in Washington, D.C. this past July, where Henry was a welcome participant because of his extraordinary history with this disease. Always the happy warrior, he continues to push us all and is widely respected and honored by a wide variety of constituencies since he early on grasped the tragedy that would be AIDS. With his heart and mind, he understood that the government needed to respond urgently, and he appropriately pushed very hard. Above all, and this is what so many of us admire about Henry, he wore no moral blinders because of who was becoming infected. Today, we can speak realistically about an AIDS-free generation in the future. However, Henry knows our work is not over, and now he continues to push for policies that lower the cost of AIDS drugs and offer developing nations more access to generic ARV therapies. His tireless work continues, and I can say without hyperbole that we really would not be in this position at this time now were it not for the extraordinary commitment, support, tenacity, energy, and inspiration of Henry Waxman. Truly a great man and a wonderful human being. And so, at this time, it is my great honor and privilege to express my personal gratitude to you, Henry, and on behalf of all of those here and those in our nation and around the world who have benefited from your HIV/AIDS advocacy, to present you with the 2012 C. Everett Koop HIV/AIDS Public Health Leadership Award.
Thank you very much for this award and this opportunity to be with all of you today. And I particularly want to thank Tony Fauci. It's an honor to be introduced to him on any occasion, but to be introduced by him at the time when I'm receiving the award that he earned so well last year, named after C. Everett Koop, is a great honor as well, because these two men have made such an important mark in fighting this epidemic and protecting public health. And Veronica Miller and all of you who are here today on this National Summit occasion, I salute what you're doing, because I think that you and your colleagues in research, practice, and in care are the heroes who can turn back this epidemic and make it possible for America and the world to have a generation that will someday live free of AIDS. I think we're on the threshold of that possibility, and I believe you will lead the world across that threshold. It's been a tough fight to get there, and we're not there yet. But I do look back on those past years, which were brought back to me with pictures of me with dark hair, and you too, looking a lot younger, but not as wise. Those periods of time decades ago, in fact 30 years ago, when we held our very first hearing. We made it past the years of denial, when President Reagan wouldn't even acknowledge that there was an epidemic. He wouldn't say, until the very end of his administration, the word AIDS. He inadvertently, however, created history when he asked the Surgeon General C. Everett Koop to do a full report on this epidemic. We fought to enact the Ryan White Act, which is now providing care to 500,000 Americans living with HIV/AIDS. We sidestepped, as Tim Westmoreland said in the video, the hysterics of people who said everybody's going to get this disease, and the fanatics who said we've got to have quarantines, we've got to keep infected children out of school, and infected adults out of the workplace. And we made it off the roller coaster of panic, followed by apathy, and then followed by panic again. We have made progress, and we have the opportunity for making additional progress. We have treatments that keep people alive and healthy, and that is really remarkable, because at one time to say you had AIDS, we didn't know HIV, but to say you had AIDS was a death sentence. We have treatments that keep people alive and healthy. We have the opportunity to turn effective treatments into widespread effective prevention. We've gone from a president who didn't have a clue about AIDS to one who has a comprehensive strategy for the nation. And just around the corner in 2014, we will have the promise of universal health insurance, making these medical miracles genuinely accessible. But as far as we've come, there remain real barriers to achieving the goal of an AIDS-free generation. In fact, we face big problems almost immediately. The first are the threats posed by the so-called fiscal cliff, which is the subject of discussion right now in the weeks that we have between now and the end of the year. The first threat of this fiscal cliff is the across-the-board cuts of the sequester that's scheduled to take place on January 2. Now, fortunately, Medicaid and veterans programs are exempt from these cuts, but the AIDS Drug Assistance Program is not, and there may be 15,000 people who will lose access to drugs. And NIH is not exempt from the sequestration, and there may be 2,000 fewer research grants. And the Centers for Disease Control is not exempt, and there may be thousands of fewer people tested for HIV. And FDA is not exempt, and that may mean every review and every inspection is going to be slower by more than a month. This whole sequestration idea is meat axe cuts on our budget, whether it's for national defense or domestic programs, is such an awful policy that we thought, or at least the original thinking was, that we would never let it happen. It was supposed to be a doomsday machine that no one wanted to explode. But if the Republicans in the House remain intransigent about preserving tax breaks for the wealthiest among us, the sequestration could be triggered. The other major risk is even if we avert the sequestration, in order to avoid it, we're not only looking at changes in the tax law, but other parts of the law as well, called the entitlements, as if that were a dirty word. And entitlements are Social Security, and Medicaid, and Medicare. Because a lot of people say, well, they may be exempt from sequestration. In order to solve the problem of the fiscal cliff, we've got to make cuts in these programs. Well, I think few groups will understand the false economy better than those of you who work on behalf of people with HIV/AIDS. It may sound benign when we hear people say, well, we just should propose a slower growth in programs that now grow more costly than what the rate of increase in our inflation is. When Congressman Ryan specifically suggests we should just slow the growth of Medicaid and Medicare, and then they usually go on to say something like, nowhere else in Washington do you hear people say slowing the growth is a cut. Well, it is a cut. You have to look at just the history of AIDS to see how dangerous these proposals are for people living with HIV and with any chronic illness or disability. When we began the era of AZT as a treatment of choice, it was the only treatment that was helpful. The cost of drugs per patient was around $8,000 per year. When the first antiviral cocktail was approved, the cost of care immediately doubled. And now, even as newer antiviral drugs are available, the cost is frequently more than that. If federal funding for health had been limited to growth in the consumer price index, those new drugs could not have been provided. Indeed, cuts in coverage and care would have been inevitable. And that's just a concrete way to dramatize that slowing the growth to the growth of inflation is a cut for millions of people that are going to be looking to Medicare and Medicaid as the programs that will help them through their problems. Well, we need to do better than this. We have time and time again made it past the extremists and the apathetic, and I don't predict that it will be easy. Nothing about HIV has been or will be easy, but we have important resources we didn't have in the past. Alliances between people with HIV and those with other chronic illnesses and disabilities. communities of researchers and care providers, all working to make AIDS a thing of the past, and momentum toward pulling the nation together over HIV instead of pulling it apart. In many ways, the initial work for the namesake of this award, Surgeon General C. Everett Koop, started the creation of these resources when he made his report to the nation about AIDS more than 25 years ago. He illustrated for us how we've got to pull together. And this summit, as you've had every year, becomes an opportunity for those of you working in this field to pull together, to insist that the nation stand behind its commitment to people with HIV/AIDS, people with chronic diseases, people with other illnesses that look to the healthcare system for control, cure, and prevention of those diseases. And I'm proud to receive this award named after C. Everett Koop and to be honored along with Anthony Fauci to receive the third C. Everett Koop Award. Thank you all very much. Let us work to make sure that the progress we've achieved becomes just a step in the progress that we hope to achieve and expect to achieve to conquer this disease. Thank you all very much.